Only 44% of managers globally have received any formal management training. That means more than half of the people responsible for your team's well-being, engagement and performance were never taught how to do it. They were promoted because they were good at their jobs, not because they were trained to lead people. And the data on what that costs is significant. This is what the talent. The Gallup research is clear. 70% of team engagement variance comes from the manager. When managers receive formal training, active disengagement on their teams drops by half. When they receive coaching-specific training, team performance improves 20 to 28%. Half. Not from a wellness app. Not from a mental health day. From a trained manager. Burnout is almost as influential as salary when employees decide to leave. 15% of professionals resign due to exhaustion. Only 1 percentage point behind those who leave for a pay increase. The manager is the primary variable in both outcomes. And most organizations are not investing in that variable with the seriousness the data demands. The number one driver of burnout is unmanageable workload. 52% of employees cite it as their primary cause. And yet most managers have never been taught how to evaluate team capacity realistically. What the training needs to cover, how to map what's actually on the team's plate, not what's in the job description. What's actually being done. How to identify overload before it becomes a crisis. The signs. Missed small deadlines, shorter responses, reduced initiative, increased errors. These are capacity signals, not performance problems. How to prioritize and reprioritize work using a simple framework. What is urgent and important, what can be delayed, what can be delegated or dropped entirely. And critically, how to have the workload conversation after a restructure. When 3 people's work lands on one person, that conversation is not optional. It is the manager's most important intervention point. Burnout surfaces quietly before it becomes visible. By the time an employee is in full burnout, the organization has already lost months of early intervention opportunity. What the training needs to cover, the 3 WHO-defined stages of burnout: exhaustion, the employee is depleted but still functioning; cynicism, withdrawal, reduced commitment, emotional distance; reduced efficacy, performance visibly declining. Most managers only notice stage 3. The training should focus on stage 1. The behavioral signals to watch: reduced participation in meetings, shorter, less engaged communication, withdrawal from relationships they previously invested in, pattern of absences, particularly Mondays and Fridays, decreased quality in work that was previously strong. These are not attitude problems. They are distress signals. And catching them at stage 1 requires a manager who knows what to look for. Most managers do one-on-ones. Few do them well. A meaningful check-in is not a status update. It is not a performance conversation. It is a dedicated space where the employee feels genuinely heard as a person, not just as a resource. What the training needs to cover, the difference between a check-in and a checkup. A check-in says, how are you actually doing? A checkup says, are you hitting your numbers? Both are necessary. They are not the same meeting. The specific questions that open genuine conversation: what's feeling most difficult right now? Is there anything on your plate I should know about? What do you need from me this week that you're not getting? And perhaps most importantly, how to listen without immediately trying to solve. Employees who feel heard are significantly less likely to reach crisis burnout. Not because the problem was solved. Because they didn't carry it alone. Google's Project Aristotle, the largest study ever conducted on team performance, found psychological safety to be the single most important factor in high-performing teams. Not talent. Not resources. not strategy. Psychological safety. The belief that you can speak honestly without fear of punishment or humiliation. What the training needs to cover: what psychological safety actually looks like in daily behavior, not as a concept, but as a practice. How a manager responds when someone raises a concern. How they handle mistakes, as learning opportunities or as evidence of failure. How they respond to disagreement with curiosity or with defensiveness. These micro-behaviors, repeated daily, either build or erode psychological safety. And 39% of employees say they would not feel comfortable telling their manager they were struggling. That number is the direct result of how managers have responded in the past. When they responded well, employees came back. When they didn't, employees went silent. And eventually, they left. Recognition is one of the most researched and most poorly executed management behaviors. Employees who receive meaningful recognition are 4 times more engaged. And yet most managers either don't recognize at all or do it generically. Great job is not recognition. Great job is noise. What the training needs to cover: specific recognition, naming exactly what the person did and why it mattered. The way you handled that client conversation on Tuesday, de-escalating without conceding anything, that's exactly the judgment we rely on you for. That sentence takes 15 seconds. Its impact lasts significantly longer. Timely recognition, as close to the behavior as possible. Recognition that lands 2 weeks later has a fraction of the impact of recognition in the moment. Public versus private, knowing which employees want recognition in front of the team, and which find it uncomfortable. One size does not fit all. And peer recognition programs, creating structures where colleagues recognize each other, that generate engagement effects that manager recognition alone cannot achieve. The conversations most managers avoid are the ones that matter most. Addressing underperformance. Discussing mental health concerns. Delivering feedback that challenges. Setting limits on unsustainable work patterns. What the training needs to cover: a framework for preparing difficult conversations, specific behavior, specific impact, specific ask. Not, you seem disengaged. But, I've noticed you've been less present in team meetings over the past 3 weeks. I want to understand what's going on and how I can support you. How to have the mental health adjacent conversation without crossing into clinical territory. A manager's role is not to diagnose. It is to notice, to name, and to connect. I've noticed you seem stretched. I want you to know I'm here if you want to talk. And here are the resources available to you. That is the full scope of what's required. It is also the full scope of what most managers have never been taught to do. 6 modules. Workload management. Recognizing early burnout signals. The meaningful check-in. Psychological safety in practice. Recognition that actually works. Difficult conversations. None of this is complicated. All of it requires training. And only 44% of managers have received any. The organizations investing in this training right now, in a moment when burnout is at a 6-year high and manager engagement is at 27% globally, are building a capability that compounds. The ones that aren't are managing the consequences. 1 resignation at a time. Disclaimer: this content is based on 20 years of HR experience and is for informational purposes only. This is what the talent. The move is yours.